Good afternoon, and welcome to Maine Public Health Association's 2021 awards ceremony. My name is Becca Bolus, and I'm Executive Director of Maine Public Health Association. I am so excited to welcome you to this very special event and look forward to celebrating our award winners' work in public health. Thank you all for being here with us today. For the past 14 months, public health has been at the forefront as we have faced the worst public health crisis in a century. Maine's public health workforce has worked tirelessly to support pandemic efforts in addition to addressing other ongoing community health challenges. All of Maine's public health professionals deserve our deepest gratitude. Our public health awards this year recognize truly exemplary public health leadership and advocacy and the work of people who are serving the most vulnerable in our communities. Many of you have worked with our awardees on key public health initiatives, and on behalf of Maine Public Health Association, I want to thank you too for your time and commitment to protecting and promoting public health in Maine. This is the agenda for this evening. A few logistics before we get started. If you have any questions or any issues with connectivity, please use the discussion feature that's in the Vimeo setting, and we will do our best to monitor it during tonight's ceremony. I also want to thank Heather Drake, our membership manager, for her efforts organizing tonight's event. Frederick from EventEye, which is the platform that we're using, for his assistance, very generous assistance with all of the technology for this evening. And Sarah Rines, MPHA's past president, and the other members of our board awards and nominations committee for their time reviewing the nominations that we received and selecting tonight's winners. There is a lot of public health work being done in Maine, and we received many strong submissions. I want to thank everyone who took the time to nominate a colleague for their work in public health. Okay, let's get started. Our first award this evening is the President's Award, which is the highest award given by MPHA. The nominations for this award are solicited and vetted by MPHA's past presidents. Congratulations to Dr. Nirav Shah, Director of Maine CDC, who is this year's award winner. Director Shah was nominated by Dr. Dan Onion, who will now share some remarks about why he nominated Director Shah.
I was pleased to nominate Dr. Shah for the Maine Public Health Association's President's Award, and am even more pleased that my fellow past presidents agreed with that nomination. Dr. Shah has been a great help to all Maine citizens, and I'm sure most already recognize that, especially those of us working in public health. When he arrived from Illinois to become Maine CDC director in June 2019, the CDC had had a tough previous 8 years. Governor Mills had arrived in the Blaine House just 5 months earlier and immediately began building back the public health programs. His eclectic background includes dual University of Chicago degrees in medicine and law, training at Oxford, work in Cambodia, a law practice, and heading the Illinois Public Health Department. Fortunately, Governor Mills's astute assessment of his qualifications, as well as his own of Maine's, together opened the way for his coming here, and just in time. 6 months after his arrival, the pandemic of the century hit. Dr. Shah began his twice-weekly news conferences, as well as ones with healthcare workers. He recruited Dr. Stephen Sears to come out of retirement to help, among other ways, by running regular sessions for Maine clinicians to stay current about the disease. Dr. Shah's transparency about everything during such rapid COVID changes is crucial to saving lives. Public health methods, incidence and outcome data, resources, plans, and strategies. He has smoothly moved resources around quickly to maximize epidemic control. That approach has helped Maine understand what is important and thereby consistently lead the nation in controlling the disease. I'm impressed with his inspirational leadership, his compassion for those suffering from COVID, his scientific rigor, his ability to bring out the best in others by praising the positive, his educational skills, his lack of condescension, his ability to collaborate effectively with Governor Mills and Commissioner Lambrou, and lastly, his incredible stamina and endurance for over a year now. He seems to be everywhere. We all owe him a great deal of thanks for his selfless dedication and hope he stays in Maine a long time. Thank you.
Thank you for bearing with us. Sorry about that. I'm glad that you could hear Dr. Onion's nomination. And now, Director Shaw, I invite you if you'd like to make some remarks.
Great. Well, good afternoon and good evening, everyone. Before I go forward, can most folks hear me? I'll in a weird way, I'll take silence as a yes, although if you couldn't hear me, you'd be silent either way. So maybe not a useful question, but let me first start by expressing my heartfelt thanks to Dr. Onion, as well as the entire team of past presidents with underinvestment that has then led to difficult times. And then when an emergency hit, we were left not just to build, but also to come back together as a public health community in order to respond and provide services for those whom we care about. That again is what makes this particular recognition all the more meaningful, because the truth of the matter is I am just somebody who was privileged to be able to speak on behalf of the community of public health practitioners across the state of Maine. I think everyone who is watching and joining this evening knows or should know that much like an iceberg, there is a large team of people, both at the state and not with the state, who have been working tireless hours over the past 15 months to keep Maine safe as possible from COVID. The truth of the matter is, and I mean this not with any false humility, I'm privileged to be able to talk with the public about all of the work that gets done, but it's every single person in Maine who's doing that work that empowers me, that allows me to talk about the good and sometimes not so good of what's happening. But really, truly, I wouldn't be able to do any of that were it not for the dedicated group of public health practitioners that we have across the state, top, bottom, east, west. It's that group that has made Maine where we are right now in terms of our response. And so I am honored to be able to accept this award, but truly I accept it on behalf of everyone involved in public health in Maine. And the fact that I've had the privilege and the honor of being able to be a part of that community is quite meaningful. So I'm deeply appreciative. So thank you so much.
Thank you. Oh, we're so happy to have you here, and congratulations again. Let's see. And there's Director Shaw and Dr. Onion with the award from yesterday. All right, so next in our agenda is the Public Health Program of Excellence Award. The goal of this award is to increase the visibility of public health initiatives in Maine, to promote the adoption of effective public health programs, and to provide recognition to organizations involved in successful collaborative public health initiatives. Congratulations to New Mainers Public Health Initiative, this year's award winner, recognizing in particular their efforts to serve the needs of the New Mainer community during the COVID-19 pandemic. Ben Hummel and Kaylee Hess nominated New Mainers Public Health Initiative, and Ben will now share some remarks about their work.
Hello, my name's Ben Hummel, and Kaylee Hess and I nominate the New Mainers Public Health Initiative, led by Abdul Karim Saeed, for the Public Health Program of Excellence Award. Since its inception, New Mainers Public Health Initiative has proven to be an effective, creative, and community-driven initiative that focuses on the silent health issues impacting immigrants and refugees in the Lewiston-Auburn area. MPHA has empowered community members to take control of their health care by promoting better health habits, disease prevention, and health literacy. The organization has been a strong advocate for immigrant families with children that experience intellectual disabilities and lead poisoning. MPHA seeks to build resiliency and capacity within the community by supporting professional development opportunities for New Mainers. MPHA has always provided important public health services, but their work to protect their community during the pandemic is worth applauding. When the pandemic hit, they pivoted quickly to virtual programming and were a leader in the effort to ensure that the state recognized and responded to the effect of COVID-19 on people of color. In response to the challenges posed by the pandemic, MPHA mobilized a team that disinfected public spaces where community transmission was a concern. They educated their community about social distancing. They helped local businesses implement public health guidelines, and they provided support to students as they transitioned to online classes. It is with great pleasure that we recognize NMPHI for demonstrating excellence in community-driven and innovative public health efforts. They are a vital resource for those that they serve, an important ally for other organizations working in the public health field, and a keystone in Maine's public health infrastructure.
Great, thank you. Abdul Karim Saeed and Hamda Ahmed from NMPHI are here to accept the award. And so now I invite you if you would like to make some remarks.
Hi, hello everyone. Great to be part of this Public Health Award ceremony. My name is Hamda. I am the Program Manager for New Maine Public Health Initiative. On behalf of NMPHI founder, member, and staff, we are grateful to be nominated by Maine Public Health Association for the 2021 Public Health Program of Excellency. This year was very tough for the people of color that were disproportionately affected by the pandemic. And I would like to thank all our generous donors that supported our work, the volunteers and other ally organizations that supported us. And I would like also to thank all NMPHI staff that worked tirelessly. Without them, our mission would not be accomplished. And big shout out to the one who nominated us. This means a lot. Since the pandemic started, NMPHI recruited 12 community health workers to serve the community of Lewiston and Auburn, and also to support the Arab speakers living in Augusta area. And we also expanded our service to the Portland area. So CHW were able to cover 8 different languages spoken within our community. And on the top of that, they were trained to do emotional support, social support, family navigators, and vaccine and education outreach, which I believe they played a big role in the healthcare field. Almost 500 families were living in the Lewiston and Auburn area were reached out by phone during the summer of 2020 to assess the needs of the community. And that's when we realized that a lot of community members were affected by the virus, but were not seeking medical attention because of the misinformation that they had at that time. This ceremony means that we are going to do more work, especially fighting the health disparity and inequality that exists, because this award motivates us. And I would like to congratulate all the other individual winners and organization. Thank you for giving us this opportunity. And I have this beautiful award right here. Thank you again, and good luck.
Me. Oh, okay. Well, thank you, Hamda, and congratulations again to New Manor's Public Health Initiative. The next award is the Ruth S. Shopper Memorial Award, which recognizes an individual who has made a significant contribution in the area of public health. The individual will have demonstrated a broad orientation to health promotion and disease prevention that extends beyond their specific profession or field of interest. Nalita Burke, Minority Health Program Coordinator at Portland Public Health and Human Services, is this year's award winner, recognizing her dedication to health promotion and disease prevention in service to Greater Portland's immigrant communities. Victoria Chicon will share some remarks about why she nominated Nalita for this award.
Good evening. Nelida Burke began her career as a young entrepreneur in the port town of Callao, managing a small business in one of the most challenging, male-dominated, and often crime-ridden work environments of Peru. Later, Nelida came to the United States, chasing the American dream, but always guided by her unwavering faith and spirit of community and partnership. These values have informed her choices, always looking for opportunities to serve disenfranchised and most vulnerable populations. Early on, Nelida lost her beloved spouse. This irreparable loss left her as sole support for her daughter Shani. But her courage and big heart turned that sadness into strength. Day by day, she continued looking for ideas to improve the welfare of the immigrant community of this state, bringing together leaders, organizations, and groups toward this effort. Her efforts to establish liaison among the diverse communities enrich Maine's social environment through SHAO programs, stakeholders, and advisory committees, creating and promoting cultural and social events such as soccer tournaments, dancing, and yoga programs that helps the communities to learn and practice healthy habits and acquire the knowledge of the different services available for them. Thank you, Nelida, and thank you, Maine Public Health Association, for giving us the opportunity to offer public recognition for a young woman who has changed the community health landscape in Maine, a professional on a permanent mission in favor of her peers in the minority community. Thank you.
Thank you, Victoria, and congratulations, Nelida. I invite you now if you'd like to make some remarks.
Thanks. Sorry, I'm very emotional. I'm sorry. Thank you, Becca, and thanks to the Maine Public Health Association for this recognition. And I would like to start by thanking God for all his blessings. Thanks also to Victoria Chicon for nominating me. This means a lot to me as she is one of the minority health program Latino CHAOs, and her community is one of the most vulnerable populations we serve. I want to thank my team of CHAOs for implementing our projects, activities in the community. My mother, who is in heaven, for teaching me the value of empathy and compassion. Thanks, Mom. My husband, who is also in heaven, as he is the reason that I ended up in this wonderful state. I thank my daughter, Shani, for being patient and understanding with me while I worked many hours to better serve our community. And when I went back to college, to the City of Portland Public Health Division for giving me the freedom to create initiatives that will improve our public health, to the Mask School for providing me the knowledge to advance our public health, to community-based organizations and faith leaders for opening their doors to me and allowing me to bring our services to their facilities, to our partners and alignment stakeholders for their trust and support, and to grantors for providing the funding for our initiatives. I would like to dedicate this award to our frontline heroes, especially to those who work at farms, factories, grocery stores, and restaurants. You all have my respect and gratitude. Dear friends and partners, our fight against COVID hasn't ended. So let's keep working together in bringing the community wisdom to the planning and decision table through our chows. Thank you again, and God bless you all. Thanks.
Thank you, Nolita, and congratulations again.
Thanks, Becca.
Our next award is the Phoebe Conray King Access to Healthcare Award, which recognizes an individual or individuals who have made a significant contribution to improving access to healthcare in Maine. The individuals will have demonstrated leadership abilities in promoting increased access to healthcare by all people in Maine, and will have made a significant contribution toward meeting the needs of the uninsured and medically underserved. Knox Clinic is this year's award winner, recognizing its efforts to reduce health disparities in Maine through access to comprehensive healthcare for all. Jen Gunderman will now share some remarks about why she nominated Knox Clinic for this award.
A little public health fun fact to start this award presentation. Knox County is the only county in Maine that does not have a federally qualified health center on the mainland. Trust me, it's not for lack of trying, that is for sure. So it begs the question, where do people in Knox County with little to no health insurance go for healthcare? Knox County is filled with lobster women and men, fishermen and women, boat builders, farmers in Rockland, Thomaston, Warren, Owl's Head, Hope, Camden, Rockport. Well, many go to the Knox Clinic, started by Dr. and Mrs. Kleiner, decades ago when they came back to the land in Maine. The Knox Clinic kind of reminds me of Narnia. You find them sort of tucked behind the Rockland Library in a building also shared with Penn Bay and Maine Family Planning. Yet behind the unassuming doorway, you enter an incredible network of dedicated and passionate volunteers, and kind of a beautifully and authentically and genuinely architected healthcare infrastructure that all provide compassionate and high quality care to the community. Specifically, the Knox Clinic provides medical care, dental care, prescription assistance, mental health, and wellness services for little to no cost. On their website, it states that they believe that everyone deserves access to quality care. Well, I can tell you that is not simply a statement on their website. They believe that. It is in their bones. And it's not just a belief, but they actually do something and move mountains to provide that high quality care. Over the years, I've taken a number of healthcare professional students to visit the Knox Clinic and to talk with Dr. Kleiner and Meredith about the clinic's origins, its purpose, its operations. And every single time, without fail, I see the students sit there in awe and hang on to every word. I can almost see the inspiration, the compassion, the humility passed from Dr. Kleiner and Meredith to my students, and I am deeply grateful. One time I asked Dr. Kleiner, what is one aspiration that he has for the clinic? And he says that he hopes one day that he works himself out of a volunteer job as the medical director, that there's no longer a need for the clinic because the healthcare and public health system are accessible, equal, and equitable. It is my honor to present the Knox Clinic with this award.
Thank you, Jen. Meredith Batley, Executive Director of Knox Clinic, is here now to accept the award on their behalf. Meredith, I invite you now if you would like to make some remarks.
Wow, Jen, thank you so much for your kind words. I love the idea that I get to enter the wardrobe and work in Narnia every day. What an honor it is to receive this award on behalf of all of our volunteers, our staff, and our family of supporters. You are our magic. It is wonderful to be part of such a spirited, compassionate crew. One of the real joys of being a part of the Knox Clinic is working with our patients, though one that works hard but has been bounced around the healthcare system and racked up debt from emergency visits. And then they reach our doors and they are ready to make some changes in their life and to help them quit smoking or lose 10 pounds or bring back their smile without worrying about debt or deductibles. What a gift. If you can't make it, well, here's a gas card or minutes for your phone so we can do a video appointment. We dream of a healthcare system that is resourceful and fair, holistic, and available to everyone looking for a welcoming door. It is a thrill to be recognized for our work and the importance of affordable, accessible care. Thank you, Jen and the Maine Public Health Association. And thank you to the hundreds of people touched by our story who have helped us grow along the way. Thank you.
Thank you, Meredith, and congratulations again. Our next award is the Pamela M.B. Studwell Tobacco Policy Award, which is given to an individual whose dedication, persistence, and passion for improving lives has significantly advanced best practice tobacco policies in Maine. Kirsten Goodrich, Tobacco Prevention Program Coordinator of the city in the City of Portland Public Health Division, is this year's awards winner. Bridget Rosher will now share some remarks about why she nominated Kirsten for this award.
Hi, everyone. I was so thrilled to learn that Kirsten Goodrich was selected as the recipient of this year's Pamela Studwell Tobacco Policy Award. Kirsten is the program coordinator for the City of Portland Public Health Division's Tobacco Prevention Program, Maine Health's Cumberland County District Tobacco Prevention Partner. From the onset of the COVID-19 pandemic last March until the time I nominated Kirsten for this award, she had led her team in passing 41 best practice tobacco policies throughout the county. The areas of focus for these policies include schools, youth-serving entities, workplaces, multi-unit housing, and healthcare sites. Notably, among the 41 policies passed in the last year, Portland's Tobacco Prevention Program recently passed a best practice policy with Community Housing of Maine. The impact of this policy will reach well over 1,000 residents in 787 units across 20 sites. In March of 2020, as with most people, Kirsten's team transitioned to working remotely. This could have negatively impacted the team's productivity and ability to pass policies, and this likely would have been somewhat acceptable in the context of a global pandemic, but Kirsten did not consider that. She challenged her team to find alternative ways to engage with the community and ensure that the harmful effects of substandard tobacco policy and tobacco use remained relevant in the minds of Mainers. These achievements have certainly been a joint effort among Kirsten's outstanding team of 6, but would not have been possible without her leadership. Kirsten has showcased her ability to adapt as the familiar landscape around her changed dramatically, and to respond with creative and thoughtful approaches to advancing best practice tobacco policies in Maine. Kirsten's focus and determination is unmatched, and she's an exemplary leader in the tobacco prevention community. Kirsten, on behalf of the Public Health Division, congratulations. We are so proud to work alongside you.
Thank you, Bridget, and congratulations, Kirsten. I invite you now if you would like to make some remarks.
Thank you so much, Becca, and thank you so much for all of the kind words, Bridget. I'm just kind of left in awe after listening to that video. But I did want to say I'm incredibly humbled and filled with gratitude to accept the Pamela M.B. Studwell Tobacco Policy Award. I am honored to join past award recipients who have spent their professional career dedicated to advancing best practice tobacco policies throughout the state of Maine. And I first wanted to just say yet again, a special thank you to my manager, Bridget Rauscher, for not only nominating me for this award, but allowing me to take the reins on the tobacco prevention grant. Thank you for all of your guidance and for truly being a mentor. I'd also like to extend a sincere thank you to Maine Public Health Association for selecting me for this award. I am humbled to be nominated alongside some of Maine's most dedicated public health professionals. So a huge congratulations to all the nominees and award recipients. Lastly, and I would say probably most importantly, I wanted to thank my team at the Portland Public Health Division, Hawa, Danny, Val, Eleanor, and Madeline. I truly owe this award to all of you. To me, this is our program's award. This team handled this year's uncertainties with grace and the willingness to adapt to community, to continue prevention efforts in regards to tobacco and vaping. This team collectively has been able to strengthen since then over 50 tobacco policies while promoting environmental change within Cumberland County over the past year. I truly believe that being a part of a team that is so dedicated to public health and to eliminating tobacco-related disparities result in what may be one of the most successful grant years. Although I will admit it has certainly lit a fire within me. 5 years into my professional public health career, and I can say with certainty, I am most proud of supervising this team as we all share the same dedication and passion for tobacco control and prevention within our community. I look forward to continuing my tobacco prevention efforts and to working collectively with professionals across the state to reduce second and third hand smoke exposure with even greater hopes of a tobacco-free future. Thank you again. I truly am so honored.
We're truly so happy to give you this award. So congratulations again.
Thank you.
Our next award is the Public Health Policy Champion Award, which recognizes a policymaker who has made a significant contribution to public health in Maine. Assistant Majority Leader in the Maine House of Representatives, Representative Rachel Talbot Ross, is this year's award winner, recognizing her decades of activism and leadership in protecting public health and promoting health equity in Maine. Representative Talbot Ross was nominated by Carol Kelly, who will now share some remarks about why she nominated her for this award.
Good afternoon, everyone. My name is Carol Kelly, and I'm a public health consultant here in Portland. And I'm so honored to introduce Representative Rachel Talbot Ross, who is the recipient of this year's Public Health Policy Champion Award for her decades of activism and leadership in protecting public health and promoting health equity in Maine. If you look for the inspiration, the strategy, or the driving force behind Maine's most important public health policy achievements of the last 4 years, you're likely to find Representative Talbot Ross. But long before Rachel was elected to the Maine legislature, Rachel had already spent years in community service doing the work of public health. Affordable housing, healthy food, safe water, economic security, criminal justice reform, voter registration. Rachel's work in public health and health equity is far-reaching, empowering and giving voice to individuals and communities. And on every issue, Rachel sees not only the immediate and specific need, she sees the system behind it and how the larger systems are interconnected. Rachel intuitively understands how relatively small investments in individuals and communities and programs and policies can shift entire systems. Rachel gets the ripple effect, and she makes sure there are plenty of ripples to propel us forward. Rachel also knows when the time is right to create some tidal waves. Maine legislature's creation of the Permanent Commission on the Status of Racial, Indigenous, and Maine Tribal Populations is certainly one of Rachel's finest achievements. The Permanent Commission is transforming how lawmakers approach policies and policymaking. It is both innovative and practical, courageously and boldly addressing long overdue systemic and structural design failures. Rachel's vision and clarity around systems, paired with her understanding of the essential role of inclusion and empowerment of individuals, makes her an extremely effective policymaker and advocate. And I'm honored to introduce this year's Public Health Policy Champion, Representative Rachel Talbot Ross. Congratulations, Rachel.
Representative Talbot Ross, I invite you now if you would like to make some remarks.
Well, thank you all so very, very much. I want to just thank Carol Kelly particularly for the nomination. as none of this work, indeed the health equity movement that we have here in Maine, could be possible without her leadership. So thank you very, very much, Carol. And to Becca and the entire Maine Public Health Association family, I want to thank you for this acknowledgement. I will also give my gratitude to the brilliant work of the other 2021 public health awardees, Nelinda Burke, Kristen Goodrich, Erin Rhoda, Sarah Johnson, the City of Bangor's Wellness Committee, the Maine Access Immigrant Network Community Health Worker Team, and the incomparable, the brilliant Dr. Nara Shah. I was so sorry not to be able to join you on May 20th for the Spring Awards ceremony and to listen to all of the other awardees. I am constantly just inspired by their work, and I really am sorry that I had missed that opportunity. I also just want to acknowledge that during this time, this unprecedented time in our history, as we are trying to fight the twin pandemics of COVID and systemic racism, I feel proud that Maine has finally acknowledged that racism is a public health crisis. And I want to thank each and every one of you for doing your work to make Maine a health and equitable place to live, work, and play. I also just want to say that your resiliency, your courage, it is your sacrifice and your commitment that really is the champion of public policy here in Maine. So thank you all very, very much.
Thank you so much. Your deep commitment to systemic change and to multi-sector and broad-reaching change is serves as a role model, I think, for many of us that are here today and for others that aren't. You are truly a trailblazer, and your leadership is so appreciated and valued. And like I said, we are so honored to be able to recognize you today with this award, and we feel very honored that you're here as well to share more about the work that you're doing in the legislature. Our next award is the Public Health Journalism Award, which recognizes a journalist or a team of journalists who has made a significant contribution to public health in Maine. Erin Rhoda, editor of Maine Focus at the Bangor Daily News, is the recipient of this year's award. Two MPHA board members, Drs. Noah Nesson and Jeff Gratwick, nominated Erin, and they will share some remarks now about her work.
Hello, my name is Noah Nesson and I'm president of the Maine Public Health Association, and I am very pleased to co-announce Erin Rhoda as the winner of the Public Health Journalism Award. When I think of investigative journalism, especially that which is focused on the well-being of our communities, Erin's work is the model that comes to mind. She is curious, thorough, precise, and deeply informed, and she's a great writer. As an example, her work on addiction helped to humanize the people struggling with opioid use disorder by telling their stories, and it also elucidated the impact on their families and their loved ones and exposed the barriers that they face when seeking care for their illness. She's done some similar work on a variety of other important issues that we face here in Maine and across the country, and that work and her team's work have been recognized with awards. It's great to add this award to those recognitions, and thank you, Erin, for your ongoing great work. Congratulations on winning this award, and congratulations to you and Matt for your growing family.
Good afternoon, Erin. I wish that I could give this in person, but the video is the next best thing, and I'm delighted to second Noah's speech recently he gave for you on this nomination. I've known you for a long time, and I'm a great admirer. I admire Matt too, but you're the woman of the hour, and you have a great admirer here, because really you're what investigative journalism is all about. I have to say that when I read the BDN, if I see your byline, I usually read to the end of the article. Sometimes I read the end of other articles, but yours most assuredly so, because you do really very, very well. I'm very proud to be associated with you. I'm a little ambivalent about this, but I was talking to Lucy a while ago, and I thought of you as a mongoose. That is, you're curious, You have a sly smile. And I don't really know if your nose twitches when you're hot on the scent, but I suspect it might. Mongoose are one of my favorite animals, and so I mean this as a compliment for you. I'm recording it on Mother's Day. I'm very happy for you, soon to be a second mother of a second child, and so my best to you and the rest of your wonderful family. Thanks.
Thank you, Jeff and Noah. And Erin is unfortunately unable to join us this evening, but we will share some pre-recorded remarks from her now as well.
During the last year of the pandemic, we've all been reminded of the importance of journalism in informing the public. And so it means a great deal to have this award from the Maine Public Health Association this year in particular, not just for me, but for the Bangor Daily News. It validates a lot of the work that we try to do to tell the stories of some of society's most vulnerable and hardest to reach. So we really appreciate it. I appreciate it. Thank you so much.
Congratulations, Erin. We're so excited to recognize your work with this award. And there she is with her new baby and her award. So it's a nice photo. Our next award is the Public Health Business Champion Award. This award recognizes a business for its leadership and commitment to integrating and promoting public health values into business practices. The City of Bangor Wellness Committee is recognized as this year's award winner, honoring its commitment to promoting health and wellness for employees and the community. Dr. Jeff Gratwick, as you heard from him before, also nominated the Wellness Committee for this award, and he will now share some remarks about his nomination.
Good afternoon. My name is Jeff Gratwick, and I'm a board member of the Maine Public Health Association. I live in Bangor. And this year I'm delighted to honor the City of Bangor's Wellness Committee with the 2021 Maine Public Health Association's Award for Business Champions. This program was started approximately 12 years ago with the primary objective of keeping Bangor's 700 city employees healthy, happy, and inspire healthy lifestyle changes. The program operates on multiple fronts. It offers incentives for those who have their annual physical examinations and needed medical screening processes. It operates a summer health program, promotes outdoor exercise by featuring walks on different city paths each month. It sponsors family days at the Panko Aquatic Center and at Herman Mountain and underwrites 2 softball teams. It fosters Lyme disease awareness and hands out tick removal spoons, those small spoons people have. And this is very imaginative. It gives employees $60 per season of free coupons to spend at any of the local 4 farmers markets. The result of this latter program is both a healthier diet of fruits and vegetables for employees and a more prosperous local farming community. Last year, 215 employees took advantage of this program, and the city added nearly $12,000 to the local economy. Bangor statistics show that this program works. It's a wonderful but unsung example of how a municipality can engage in a win-win solution and improve the health of its employees. Thanks very much.
Thank you, Jeff, and congratulations again to the Wellness Committee. Heather Lavaway, Chair of the committee, and Rhonda Frazier, the committee's treasurer, are here today to accept the award on their behalf.
So thanks so much, Becca, and thanks to Dr. Gratwick for nominating such a great program. I and Rhonda are accepting this award on behalf of the 11 other committee members that represent, like Dr. Gratwick said, 700 different employees within the city. Last year was tough for us trying to find some creative ideas on how to keep the city active as well as staying within COVID guidelines. Jen Terrio is one of our committee members, and she really spearheaded the local farmers market campaign. I think that it really gave a creative way to keep our employees engaged in healthy lifestyles, diets, and getting out into the community safely, as well as keeping some funds with our local growers. Much like Dr. Gratwig said, we do a number of different campaigns within the year, and we really try to be creative. We do local swim sessions at our local pool. We do ski nights at our local mountain. We like to keep as much stuff within the community as we can and really engage as many of our 700 employees that we can. Some of the campaigns, like the softball teams, they really reach a different dynamic or population of our employees. And I just would really like to say thank you to Dr. Gratwig for nominating us, and we're very honored to accept this award. And thank you to Maine Public Health Association for considering his nomination. And
thank you to our employees for making it all successful.
Thank you.
Congratulations. We're so excited to give you this award. Our next award is the Public Health Rising Star Award, which recognizes a young professional who has made a significant contribution to public health in Maine. Sarah Johnson from AdCare Educational Institute of Maine is this year's award winner, recognizing her contributions to Maine's substance use prevention field. Scott Gannon will now share some remarks about why he nominated Sarah for this award.
Hello, my name is Scott Gagne. I'm the Associate Executive Director of AdCare Educational Institute of Maine and Director for the New England Prevention Technology Transfer Center. We are a SAMHSA-funded center that provides training and technical assistance to the substance use prevention field here in Maine and the rest of New England. I'm very pleased that Sarah Johnson, our training project coordinator for PTTC, is a recipient of the Rising Star Award from the Maine Public Health Association. I nominated her for this award because she really has been a rising star for AdCare and PTTC ever since she joined our team back in January of 2020. But moreover, I think she's been a rising star in the field of public health and prevention here in Maine, largely through some really innovative and groundbreaking tools and resources she's developed for us here at PTTC. One of the very first projects she was working on is something we launched just in the past couple weeks, which is our Vaping Graphic Medicine Toolkit in the Air. Graphic medicine is a way of doing health education through graphic novels. Picking up a brochure and learning about it a few months before Sarah joined our team, we saw that there wasn't anything really in the prevention space for graphic medicine, and certainly nothing in the area of vaping, which was becoming an increasingly important issue in our region. So on day one on the job, I hand this brochure to Sarah and ask her to look into it and come up with a proposal of how we could take this on. She quickly came back with that. She quickly recruited a subject matter expert and recruited a youth panel from Rhode Island to make sure that the youth voice was incorporated. And really, this fabulous product is a result of all of her hard work on that. And again, really, I think, innovative and groundbreaking in providing sort of a different way of doing some evidence-based, science-based prevention in the area of vaping. A couple of other important tools and resources she's led the way in developing. One is an onboarding toolkit for new prevention professionals. So someone who's brand new to the field, it's some guidance and foundational research information to help them orient themselves to a prevention profession. And then a diversity, equity, and inclusion guide and self-assessment tool for prevention that uses the strategic prevention framework and some really best practices around cultural competency to make sure that every step of the prevention process is informed by cultural competency and results in services that reach all corners and all populations of our state. So again, I'm really pleased and honored that Sarah Johnson from our team is a recipient of this very well-deserved award. I want to thank the Maine Public Health Association for recognizing her with this honor. Thank you.
Thank you, Scott, and congratulations, Sarah. I now invite you if you would like to make some remarks.
Thank you to the Maine Public Health Association for selecting me to receive the Public Health Rising Star Award. This is a huge honor, and I'm delighted to be recognized in this way. Thank you to my team at AdCare Educational Institute of Maine and the New England Prevention Technology Transfer Center for consistently being there for each other, and to Scott Gagner, who nominated me for this award. Scott is one of those unicorn supervisors who always has a metaphorical open folder on his desk for our wild ideas that often become innovative realities. Thank you, Scott, AdCare, and PTTC teams. Congratulations to the other award winners this evening, and a big thanks to my partner Ross and to my family, who are always getting pulled into volunteering in public health too. You're the light in my world. I want to take a moment to put a spotlight on the corner of public health that I'm most passionate about: prevention. Prevention aims to support people, families, and communities before an issue can occur. There are a variety of lenses through which you can engage in prevention, from child abuse and neglect prevention to intimate partner violence prevention, health risk prevention, and substance misuse prevention, and more. In my view, regardless of what type of prevention you're doing, the key to this work is positive connections and healthy communities. And it's not just prevention specialists who are doing the work. I volunteer with groups who are putting these principles to practice regularly, from the
Sure. Thank you all for bearing with us. We seem to have some technical difficulties trying to get Sarah back, and I believe we have her now.
Sorry, thank you.
That's okay.
I volunteer with groups who are putting these principles to practice regularly, from the Augusta chapter of Kiwanis to the Augusta Back to School program to the Waterville Opera House. Anyone and everyone who wants to engage in and support their community's health and resilience is doing the work of prevention. Lastly, I would be remiss not to take this opportunity to thank the public health workers who have not stopped for a moment during the COVID-19 pandemic. Substance misuse prevention is a long-term goal-oriented field, using approaches that show positive effects over time. However, the effects of COVID-19 on health, substance misuse, and substance use disorders will not wait for strictly long-term strategies. So we have doubled our efforts to maintain the course while reacting to current and emerging needs and proactively considering the changing needs of our communities in the years to come. Substance misuse prevention is a vital service in every community, and Maine's communities deserve well-funded, well-supported, and well-trained substance misuse preventionists. They've not let us down, and through supporting them in these ways, we can do the same for them. Thank you again, and this is an honor.
Wonderful. Congratulations again, Sarah.
Thank you.
All right, and last but not least is our Unsung Hero Award. As we know, public health is at its best when we don't even realize it's serving us. This award is for those who work hard every day to protect and promote public health in whatever capacity is needed and with a commitment to excellence. The award recognizes an individual, department, or organization who has positively influenced public health in Maine from behind the scenes. This year's award winner is the Maine Health Access Network Community Health Worker Team, which is being recognized for their collective vision, enthusiasm, and tireless commitment to supporting Maine's immigrant communities. The team was nominated by Michelle Mitchell and Ben Hummel, who will now share remarks about their nomination.
Hi, my name is Ben Hummel, and I nominate the community health workers at the Maine Access Immigrant Network for the Unsung Hero Award, along with Mohammed Baray and Sarah Lewis. Since the beginning of the pandemic, this team has developed innovative and responsive strategies to protect the health of new Mainer communities. The CHWs have worked tirelessly to make sure that their clients have access to accurate information, testing, material assistance, social services, and vaccinations, while at the same time they have advocated for a more equitable approach in the state's response to COVID-19. While facing tremendous challenges and barriers posed by the pandemic, many new Mainers have been able to rely on this group of informed, trained, and trusted community health workers. We are humbled by their passion, courage, and hard work, and it is our pleasure to honor them for their accomplishments and resilience in an unprecedented year.
Hi, my name is Michelle Mitchell from Partnerships for Health. On behalf of the PFH team, I have the honor of nominating the Maine team for the Unsung Hero Award. The PFH team has worked side by side with the Maine team over many years, and we have watched how they tirelessly serve their community. Here are just 3 reasons we believe they embody the Unsung Hero Award. Firstly, Maine places client needs first. Each client is treated in a way I hope people would treat my grandmother. Second, Maine believes in collaboration. This collaborative nature, devoid of self-interest, places the community at the center. Maine inspires us. We have watched Bari, Sarah, and each of the community health workers take action, rise above status quo, and make changes for the betterment of others. In the process, they have improved the lives of those around them and inspired others to achieve greater heights. Thank you for choosing Maine as your home, for all the love and the laughter. As a public health community, please know we see you and we celebrate you. Congratulations from our team to yours.
Thank you, Ben and Michelle. And now we'll hear from each member of the team. And so first we'll hear from Asha Ali.
Hi, good evening, everyone. And thank you very much for giving us this award. And I would like to thank to Michelle and Ben. And I would like to thank my co-workers who works day and night with us. And I would like to thank Sarah Lewis and Barre and the rest of the team. Thank you, everyone.
Thank you, Asha. And next we'll hear from Sana Abdul-Jabbar.
Hi, good evening. This is Sana Abdul-Jabbar. Thank you so much for this special honor from Maine Public Health Association. And special thanks to Ben Hamel and Michelle Mitchell for nominating us and acknowledging our hard work as a community health workers with Maine Access Immigrant Network. Receiving this award is a great honor because it recognizes our work and it gives an amazing feelings of getting awarded for the efforts that we put in. Thank you so much.
Thank you. Christian Bisimwa.
Yeah, thank you. It's a really very, very great honor to receive this award. My gratitude straight to Michelle, Ben as well. I cannot forget people like Sarah Lewis, who is doing a fantastic job in the shadow, even also in the front at some point. Also, my gratitude to those people who connected us to personal leadership trainings. I mean, we have a Katsuko, Tatiana, Murray, Ben, Erin. Those people give us a sort of warm-up to keep going and doing the work where we focus basically on the communication piece, helping folks to understand that they are new in the country, but there's no barriers. Even if you're not speaking very well the language, we have those conduit who can help you to express yourself and even manage your plan and even succeed in this country. Thank you so very much. It's an honor for us today.
Thank you. Mohammed Hassan.
Yeah, my name is Muhammad Hassan. Thank you very much, Maine Public Health Association, for this great award. Thank you also, Michelle and Ben for nominating our organization to this great award. Thanks also to our team leaders, Mahmoud Barre and Sarah Lewis, and all my other colleagues in our organization. This will keep us going further and serving the communities, the underserved communities that we serve always. This award is also for the great community that we serve and we worked with for the last few years. And thank you also for those who arranged this great ceremony today. Thank you very much. Thank you all.
Thank you. Samin Ibrahim.
Good afternoon, everyone. I hope everyone family is safe and you guys are all safe. Thank you for MPHA for awarding us with this award. Congratulations to all the awardees of this award. I would like to say a big thank you to Ben Hamill and Michelle Mitchell. She is my older sister from another mother. I would like to all leave you with a quote that my dad always used to tell me. I will say it in French first, then in English later. La parfaite valeur est de faire son témoin ce qu'on serait capable de faire devant tout le monde, which means the perfect merit is to do without witness that which you can do before all the world. Thank you very much.
Thank you. Sabine Kangombe.
Good evening, everyone. Thank you for this award. I would like to thank Michelle Mitchell and Ben for nominating us. Also, I would like to thank my CEO and my manager and all my team members for allowing me to be part of this incredible journey. And lastly, I would like to thank our community members and especially our clients, because we are doing this job for them. If we are here, it's for them. So thank you.
Sana Osman.
Hi, good afternoon, everybody, or good evening. My name is Sana Osman. I'd like to thank you so much, everybody, thanks first and foremost for Ben and Michelle for nominating us. And thanks to Maine Public Health Association for recognizing our effort and recognizing our work. And this has been a very hard time, but it didn't feel like a job because of the group of people, the great, amazing team that I work with, and they are great human beings. And it's been the best 7 years of my life working with you guys. And so I hope you all can continue working on and keep going. And I would like to thank Sarah Lewis, our director, and Mahmoud Barri, who's our executive director, and for their great leadership. And I'll just say, let's keep up doing the work. And I'll see you guys on Saturday for our 5th vaccination clinic, and keep up the good work. Thank you, guys.
Thank you, Sabine. Sarah Lewis.
And is Mohammed Barre, is he able to join us? Because this might be the closing. We are honored. This was a light at the end of, and actually still through a really challenging year. And this team rose to meet that challenge. And we did not do it alone. And we did it with all of the friends, family, sisters, and brothers that we consider sisters and brothers in action throughout this year and throughout the public health community. We are humbled and grateful for this nomination by our esteemed public health partners, Michelle Mitchell of Partnerships for Health, an incredible evaluation company based in Augusta, Maine, and Ben Hummel of Maine Mobile Health. Ben Hummel has been working closely with us with the Community Health Worker Stakeholder Initiative and has been doing that for several years with us, and we thank you for that work. I would also like to thank the Maine team. And before I get a little emotional, you are the family that I've been looking for. So thank you so much for everything, for showing me how to lead without saying anything, with just doing. You are incredible leaders, and I'm really excited that you're in the spotlight today. I know you all are feeling very uncomfortable about it, going. I think there's a lot more people we can help. So let's keep it up. And finally, Maine would like to share this award with our partners. We do not do this alone. With our funders, we still need you. And most importantly, the clients and the essential workers who, quite frankly, carried us through this last year. You truly are the unsung heroes, and we thank you.
Thank you, Sarah, and congratulations again to the Maine Community Health Worker team. Well, that was our last award for this evening, and I want to thank you all for being here with us tonight and to congratulate again our award winners. Your collective contributions have protected and promoted public health, reduced health disparities, and improved the policies, systems, and environments that impact health outcomes in Maine. Thank you. It has been wonderful to be here with you this evening, celebrating our colleagues and their work. Thank you. I hope you have a pleasant rest of your evening.